Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is
A Pod Full of Pediatrics.
Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge.
And this is the one where we talk about pneumococcal vaccines.
So pneumococcal vaccines are against pneumococcal disease.
Right, which makes so much sense.
I know. I love when things make sense.
And actually, strep pneumoniae is the official name. I love the
Latin pronunciation you just did. That was excellent. Yes.
Is the official name of the bacteria that was actually first identified in 1881.
1881.
It was a really long time ago.
A really long time ago. Older than us.
Yeah, definitely.
Yeah.
Well, thank God.
We're just slamming on how old we are. That's longer. That's older than us. That's like Civil War. And pneumococcus is a major cause of infection in children and adults, especially older adults. For some people, it just hangs out in their nose, doesn't cause any problems at all.
Right. But others, it can be a really big cause of problems, including ear infections. It was like the major cause of ear infections, sinus infections, pneumonias, strep pneumoniae, right? So pneumonias are a really common cause, or this bacteria is a really common cause of pneumonias. And it is the most common cause of bacterial pneumonia.
Absolutely. Did you do that thing in medical school where you had to like swab your orifices and put them on a plate and colonize them?
I know. No. I'm not that. And again, only a few orifices, right?
Well, we did that in our center where you got your nose and your mouth and you like put it on an agar plate and then you grew it out and then you like identify the bacteria. And it was terrifying how many people had like strep pneumoniae just living up their nose.
Yes.
Like it just exists.
So while it doesn't cause problem in everyone, for those that it does, especially for people who are immunosuppressed or having other issues, it can cause
just
really little kids kind of mature. And this is some of my worst cases that I remember from residency and even from after when I was working at Randall Children's. This bacteria can cause horrible pneumonias that even can cause like what we call empyemas, which is basically just pus in the lungs.
I know.
Hard to treat, takes a really long time, really painful because they have to do chest tubes and other things. And since we've really developed the vaccines that help treat or prevent, not treat, but prevent pneumococcal disease, we've seen such a decline in that across all the board, not just bad pneumonias, but also even ear infections.
Right.
And really preventing what this disease can cause systemic things of. So we think about pneumonia just in the lungs, but it can also cause bloodborne bacteria, what's called bacteremia, where that bad bacteria gets in our blood.
Meningitis, which is like infection of the lining of your brain.
And then endocarditis, which is infection of your heart and the valves of the heart.
And then septic joints, which is like the pneumonia would get into the joints of the bone. And the only way to treat that is surgery to clear it out.
And all of these can lead to really an overwhelming bacterial infection called sepsis, where that's where it can even cause organ failure of all different organs in your body. And that's really where you have this most severe disease from pneumococcal disease. And that has also decreased significantly since we started pneumococcal vaccines.
And it's an encapsulated organism, which means it has a little coating on it. So it's very hard for our body to take care of it.
Yeah. Our body's not good at getting rid of pneumococcal disease that's causing problems. Right. We really just can't fight it very well. And interestingly, some of the drugs that we use or medicines that we use to try to fight these infections, also we have to be careful of, because some of them with that encapsulated organism makes it harder to treat with specific antibiotics.
Yeah, and these bacteria, I want to say they're smart because they don't actually have a brain, but they learn and they will. Sometimes antibiotics will stop working for them because they kind of gain resistance to those antibiotics. And so pneumococcal was getting harder and harder to treat before the vaccine was created.
Yeah. And pneumococcus spreads person to person, and it's basically by inhalation or aerosol. And it leads to colonization. And then again, in those that really 50% of people have asymptomatically, but in young children, older adults, or anybody who is immunocompromised in any way, pneumococcus can really cause significant problems. And really one of the worst ones for people who don't have a spleen to fight off things.
Or they're on an immunosuppressant suppressant drug. You know, they have
Right.
another disease that was requiring them to be on a medication to control that disease, but now they can't fight off pneumococcal disease.
Right. So severity wise, much worse in kids yet less than 5 years, and especially less than 2 years. And they are much more at risk for the invasive disease.
Right.
So that goes into the blood, like
Or
the
into the
brains or that type of thing.
And this used to be like a major cause of hospitalization and death in kids when we first started out. So like fever of unknown origin, they were the kids that were admitted and you didn't know what was happening with them, and you're always worried that they had something like pneumococcal disease. And actually, before the vaccine, in the U.S., about 4% of children who got pneumococcal pneumonia would die from a disease.
Right. And then they'd also cause other things like 700 cases of meningitis a year from just pneumococcal disease, 17,000 cases of bloodstream infections, 200 deaths, and 5 million ear infections.
A year.
Like, a year. So again, when you go back to that first episode where we talked about it, like, so you think about 5 million cases of ear infections a year. How many times is that?
We were real busy.
We
were doing that. We were doing that a lot, for sure.
And we were having to treat all of those with antibiotics, right?
Right.
These were bacterial ear infections. So contrary to like your viral ear infections that we see a lot of now that we don't have to use antibiotics for, like that, we were having to use antibiotics. And if we didn't use antibiotics, they would have, worsening infection, could go to bacteremia, might have repeat or recurrent ear infections that are very difficult to treat because, hey, we've now used like 4 different antibiotics in this kid for this ear infection. So now that's resistant. And the only way that we get better is surgery for tubes. Like, again, we have, by the institution of this vaccine, prevented a lot of that. So now it is not 5 million cases of ear infections a year caused by pneumococcal. It is really so much less and makes our lives so much better. And truthfully, the lives of children so much better.
Therefore, our lives. It's correlated, kind of how that works.
Because again, we would rather them not have to be sick.
We don't like them to be sick. So it would be after the vaccine, though, a quick turnaround. We went from that, 4% of kids a year would die from pneumococcal disease to 1% after Prevnar 7 was introduced, and 0% after Prevnar 13.
Yeah. And Prevnar is the pneumococcal vaccine. So
that is the brand name.
And the number is is really how many serotypes of pneumococcal are in that vaccine. So the first one was came out with 7, and then we have expanded it more than that.
To 13.
One of the things that I kind of wanted to talk about, because vaccine history, again, super fascinating to me, and super important because there's a lot of narratives around it, but pneumococcal is kind of fascinating because it is really our failures. Like they tried all through the 1900s, the early 1900s, mid 1900s, to actually find a good vaccine for pneumococcal, and it didn't work.
Yeah.
Like, and this is where they tried to come up with things. They would test them. They didn't work, and they didn't still use them.
Right.
They were like, they scrapped it. They're like, this isn't going to happen. This isn't going to be what we're going to do. And in fact, as we got better at antibiotics, they're like, okay, we're just going to do antibiotics for it. But the reason they kept looking for those reasons, like a better answer, a better vaccine, was because even with the new antibiotics, this organism specifically would make resistance to it. Right. So we were having more and more resistant infections, and that was causing problems. And so this is, again, where really good science makes to keep children healthier before they get sick, before we have to do antibiotics, before we do that. And it was really the development of a method to bind.
Right, a different vaccine.
Yeah, right. It was through Hib, but to bind a polysaccharide with a carrier protein that really just enhanced the immune response. So it's that little piece of bacteria that they were doing, but it was the combination or the conjugation of this polysaccharide with that carrier protein that allowed us to create the immune response. I feel like you need
a blackboard so you could write on there like a little piece of protein and the conjugation.
And they put them together. And they did that first with Haemophilus.
I aged myself.
I know, a whiteboard. Mm-hmm. They did it first with Haemophilus, but then they were like, wow, this worked great. I think this could also work for pneumococcal because they are both similar types of organisms. And so then we had the first one.
In 2000. in this millennium.
I think that's right.
Yes, is when it was approved.
But think
Obviously,
about that.
It was studied for years before that.
Right, studied for years before that. But the first one that they did, and that was against a placebo, and it was the 7-valent pneumococcal.
It was tested against a placebo.
Right,
yes.
tested against a placebo, and it was 7 serotypes of pneumococcus, and they were the ones that caused the most problems.
Right.
We saw the most
severe disease.
The severe disease.
And serotypes is like the different flavors of pneumococcal disease, right?
I love how you say flavors.
Well, you don't want to taste them, but you know what I mean, like like an ice cream store.
Yeah, yes. Like slightly different types that cause, because of their different types, they cause different disease, are more likely to cause different disease. And so they picked the ones that were the most dangerous and put them in that PCV7.
And yeah, we saw a quick turnaround. We were like, wow, kids stopped dying of this disease after the vaccine.
That's right.
And we were having less kids just be sick with fevers, and we didn't know where the fever was coming from.
Unfortunately, it didn't help a ton with ear infections.
No, it didn't.
Not at that one.
Maybe just 1 million less, but you know.
But that's why they kept working on it, and they added some serotypes that did other things, like that they noted had more trouble with ear infections or pneumonias or that type of thing. And so we went from the 7, Prevnar 7 or pneumococcal 7, to 13, and that was in 2010.
Yeah.
And that did also decreased, again, like we said, both the mortality down to 0%, but then started helping more, but with ear infections, sinus infections, those types of things. And that's really where we started seeing a big difference, right? We came out of residency in 2002, 2003. So we were still seeing a lot of those ear infections, but then as this Prevnar 13 started really working, that went down for us.
Right.
Yeah.
And then now they, in 2022, went to 15 strains. And then in 23, went to 20 strains, which actually then became used for adults too.
Right.
Like we got it really good, and then they were like, "Oh, we're going to use it for adults too." Right.
Well, and it was because it's interesting because we did have one for adults and for even children who had more immunosuppressive things prior to that. But it was actually the old style of making the vaccine.
It was not conjugated.
It wasn't
when you
conjugated.
Your whiteboard again.
And so again, it didn't work well for really young kids. And so they didn't recommend it because it didn't work well for them. And so that was the what was called the Prevnar or the pneumococcal 23 Pneumovax.
Yeah.
And that one actually was only for adults and for those small populations. This now, the Prevnar 20, can be used through all age groups, which is really a big difference. And should make some difference even in adults.
Right. And it's very safe. I mean, the side effect profile is just pain at the site.
Yeah.
A little maybe redness and swelling, but a lot of that even is just the kid moving when they get in the vaccine is just going to have more reaction if the kid's moving.
Right.
Very low-grade fever.
Yeah.
Potential.
And I like to call low-grade fever, and I know parents always don't do it, but I consider a low-grade fever anything less than 102. So that's usually if you're going to get a fever with Prevnar, it'll be that. Interestingly, they do say that you're going to get like that swelling, and it's most common for swelling for DTaP and Prevnar, but it's still less than 12% of kids.
Right.
So it's not every child who's going to have it. And then finally, are there any serious adverse events causally related to Prevnar?
No.
Not at all.
None.
No. So there are none that are over what we saw in control groups. And again, this, especially that first Prevnar was tested against control groups or placebo. And then the only contraindications to either DTaP or pneumococcal vaccines are anaphylaxis to one having prior.
Right. Which is so very, very rare. But
really, really, really uncommon.
Yes.
And that's the only thing. I like pneumococcal, and I like that we talked about this.
I like it too.
As a vaccine. As a vaccine, that's right. As the vaccine Prevnar, because it really does speak to a narrative that's out there right now that we don't test vaccines.
They're really, really well tested for a long, long time.
Yeah. Like that, because not every vaccine gets tested against a control, that there's something that like scientists are trying to hide or researchers are trying to hide or that type of thing. And that's just not the case.
No.
Every new vaccine comes to market has a ton of a testing prior to that.
Mm-hmm.
And this Prevnar is actually one of the ones that highlights this. Again, they were trying for 70 years.
Yeah, since 1881, maybe. I don't know.
Yes. To make a vaccine, right? And weren't succeeding.
And
right?
Always those initial tests were against a control, which is like saline or, some nothing water injected versus using a vaccine. So we can look, are they actually working? So the initial vaccines always get tested against a control.
That's right. Always get tested against a control. Always get tested against that placebo for that initial testing. And Prevnar did. It did. Absolutely. That Prevnar 7, that first one that came out, it was tested against control. What they found was that it worked great.
Right. Okay. And was well tolerated.
But that it wasn't good enough. And so we went on to try to make it better by
I say we. Yeah.
Scientists, researchers.
I would love for us to be part of that original thing, right?
It wasn't us. But went on to make it better by adding in those serotypes. And when they added in those serotypes, it did make it better. But they didn't retest it against placebo. And there's a lot of really good reasons for that. The most being is that it's completely unethical.
Right. Right. Our first, we really do take the Hippocratic oath after when you graduate from medical school. They really literally make you do that. You stand there like you're like standing with your hand on the Bible. You don't really have your hand on the Bible, but you raise your hand and you're like, do no harm. I will do no harm, right? And that is kind of if you were testing kids using a control versus something we know actually works. Why would we do that? Why would we let them get disease just because they got the unlucky of being in the control arm?
Right. And that it's just not fair. It's not ethical. We want to keep kids healthy. Again, that is our, like, from a pediatric standpoint, our whole goal in life is to keep kids healthy. And so we would never want to have a study where we like allowed kids to get a disease that would hurt them to prove that this other medicine did better, right?
Right. So when they brought out the Prevnar 13, they tested against 7. We're like, we know 7 works. Kids tolerate it. Can they get less sick with the 13? And I think those studies show pretty fast. Yes. You'll have less ear infections if you have more strains. And that was the interesting part. When 13 came out, we had a lot of kids who had only 7, and we made a point of going and giving them 113 to get those extra 6 serotypes in there.
Right. And again, because those studies where we compared the two showed that the Prevnar 13 was better than Prevnar 7 without any increased side effects.
Right.
Again, so we did absolutely test it. We looked for those side effects. We looked to make sure that those side effects weren't worse than they were for the original vaccine and that it did improve it. And that's where each new updated vaccine, 15 and then 20, also tested rigorously against the previous vaccines. And that's the whole point, is that we keep testing them. We will always keep testing them. Part of research is making a bigger and better way to keep kids healthy, right? And we're going to do that with the least amount of discomfort and pain possible. And so that is the bigger one. The other one is feasibility, in the sense of so ethics is the huge reason why we're not going to go back and test everything against controls, only the first vaccine. But it's also feasibility. So there are some vaccines like flu, where they have to be updated every year.
Because the flu strains change.
Right. Absolutely. And while we know the base of the flu, how we make the flu vaccine, that was tested against control years and years and years and years ago.
I don't even know how old the flu vaccine is.
I don't either.
Different talk. That'll be for another talk.
I know we're going to have to find that out, but we don't know that one yet. I don't know that vaccine history about flu, but I do know that the original one was tested against control. But because there's different strains each year, each makeup of the flu vaccine is slightly different. And again, we're not going to go back and test all of those against control. We can't even do that because they change every year.
Right.
And it takes years for these tests to take place, right? So what we can do is test them against previous flu.
Right. Well, and that's what people always say, the flu vaccine doesn't work. It does work. It's just not a perfect science, right? We're just trying to get people not to end up dying from the flu or being really sick. you might get the flu. It'll just be a lesser version of
Right.
the flu.
That's right. But that is one where it's for more feasibility versus the reason why we don't go back. We couldn't even do the testing in the period of time to make a good good flu shot or a good flu vaccine. And so we understand that vaccine science is difficult.
Yeah, it's a little bit confusing sometimes, and especially when you're hearing different stories about it.
That's right. Different narratives that really aren't those narratives, like to some extent, falsehoods or have-truths can be really, and they can do really real harm to people who really are kind of hearing that versus hearing that we do test these very rigorously. And again, the only reason we pick vaccines to do are the ones that are causing really bad disease that we don't have other good treatments for.
Right.
Like pneumococcal.
For sure.
Right. This was, again, a great example of why we picked that, because it could cause real severe disease. And we did find some antibiotics that worked for a time.
Yeah.
But then they started having other problems. And so that's why this vaccine was so important. And it's a great example of both those things, that we need to find those things to help best when we can't find the treatment to work. And then second, that we always test them. So sure. It's so important to recognize that. And we just wanted to make sure that everyone realized that as well.
Right. And again, at the end of the day, we want the kids to be healthy. We want kids to be able to be kids. And if they're sick and they're not feeling good, that's not going to happen.
That's right. And so this is real information about how to keep your child safe, happy, and healthy and prevent pneumococcal infection.
For sure. All right. I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is
A Podful of Pediatrics.
Thank you for watching.